Okay, we're going to go ahead and get going since the beginning of it sort of has some introductory stuff. If someone's still roaming in, they won't miss a whole lot of the sort of meat and potatoes about what we're going to cover today on our new health plans. So I'm Mark Liberta, I'm the city's Director of Administration. One of those hats that I have is Human Resources Director. And that has me work very closely and directly with Dana and our consultants on pulling together recommendations on health insurance plans that the city can undertake. Last year we made a fair number of significant changes to our health plan and built into that some components to try to really bring some consumerism into how our employees sort of obtain their health care. What I mean by consumerism is there are a lot of options in how you pay for and how you get your health care. Just like if you go to a grocery store, the same thing can cost different prices at Walmart compared to Pick and Save, compared to an Aldi's. Healthcare can be the same way, and so we built in some things into our health plan last year to try to encourage that. Because we are a self-funded organization when it comes to healthcare. Every one of those medical bills that you or your family members take, if you're in a family plan, aren't paid for by some health insurance company. You work with United Healthcare with us, but they're just an administrator for us. We're self-funded. Every one of those bills comes directly to the city. Of our general fund, which has about a $25 million budget, nearly $4 million of that is just to pay for the health care plans for our employees. So it's a big part of our budget and something we have to manage pretty closely. So last year we made some changes in the plan and built in some things to encourage people to sort of try and moderate how they do it, such as, you know, maybe look, is this the cheapest place I can get an MRI that still gives my doctor everything he needs? You know, some of the virtual visits where you could, for a very nominal fee, have simple things taken care of and addressed and get prescriptions that you might need right off your cell phone or your computer at home. We didn't have the kind of movement toward that we really needed to help sustain costs, and we were operating at a deficit in the health insurance fund, pretty significant deficit of $700,000–800,000 the last couple of years. And so we had to make some further changes. Our goal is what we've put together this year we'll be able to keep in largely the same structure going forward for at least a couple of years, like we've tried to do, and not have changes every year. And to do that, we've made the jump to a high deductible health plan being our primary health plan. But in doing that, we've left a traditional PPO style plan as a secondary option. But the high deductible health plan is something new for many people. It's very common in the private sector. It's growing in the health insurance industry as a whole because of some of the benefits that I'm sure will come up as we go forward. But it's the fund that you can save yourself. You can travel with you if you go work somewhere else. It's money that you own and that you can take with you. That makes it fit well for a lot of private sector industries, one reason they're moving there. But it also really sort of encourages that consumerism because you're individually much more part of the impacts of the costs that happen. So we've offered that, and to help people take a good serious look at it this year, we've even built in some city contribution to what will be the savings accounts that are associated with it. And so we're hoping that along with the savings and premiums, will get you to take a good look at the high deductible health plan option that we have. And so today we're going to walk through those details of the two plans, try and make sure you have a good understanding of how a high deductible health plan and the related health savings accounts works. And to do that, we have Roger Green will do most of the talking. He's one of our consultant advisors. I always still say from Diversified, but they wouldn't change their name on me. They're now Associated Benefits and Risk Consulting. So, so he's going to do most of the talking. Dana and I will be here for questions as well, and then we'll wrap it up at the end, and there's plenty of time for questions as we go forward. So with that, I'll introduce Roger Green.
Thanks, Mark. Good afternoon, everybody. So again, what we're going to do this afternoon is I'm going to just go over some relatively general details, give you an idea of what's happened over the last few months quickly, and how we've gotten here today. And then we're going to go through the two plans that are being offered for 2017. Ask questions as we go. Don't hold them to the end, because we're taping the session. When you ask a question, I'll probably repeat it just so, because I come across well, but sometimes the questions get lost in the shuffle. We have Jimmy Terpenning. Oh, man, good, okay. From United Healthcare with us. He's here as moral support for me. I've been in this business a long time, but there are questions that will come up, very specific questions for United Healthcare that we need Jimmy here to help with potentially. So we're going to have the meeting today. I will be back next week, just so you know. I'm going to spend 2 hours here, 7 to 9 on Thursday, and 8 to 10 on Friday. So, you know, we'll be around. Jimmy and I will be around after the meeting for a few minutes if you have individual questions. I'm sure as you get through this and you take a second look at it, after you leave the meeting, there's definitely going to be questions. So I will be here next week if you want to stop in or need to stop in for a little one-on-one chat. Again, depending upon how that goes next week, if we have a lot of people who need to talk, I could certainly come back before the open enrollment ends, which is the end of November. So really the process that we have with the healthcare, we started this way back in June. I mean, we renew in January, but we start mid-year taking a look at this. And part of what I do at ABRC is my responsibility is to analyze the data. We make some projections at the beginning of the year, how we're going to perform. Here's what expectations are, what we think is budgeting levels, and then we monitor that throughout the year. Depending upon how that works or how that looks, then we get into the discussion, which takes several meetings through the late summer and into early fall, about, okay, what might need to happen with the plans and with the program based upon how we are performing. So we go through that process. We looked at many, many different options and plans and twists and turns to make sure that we had it as well as we could, or as good as we could. Then it goes to committee and all of that, and that brings us here today. So Mark mentioned the fact that the group is self-funded. And it's important, I'm not going to belabor that point, but United Healthcare, really what United Healthcare does is they manage the network for us. So all the doctors that we see are really, coordinated by United Healthcare, and they pay our claims. So when a doctor submits a bill, it goes to United Healthcare. They process it, their computer systems process it based upon our plan, and then it pays the doctor accordingly. So as Mark said, every dollar that we spend comes right out of the health insurance fund. Okay, so it's important to remember that. And so what that really means is that based upon how we use the plan and how we spend, or the services that we have provided, will more directly dictate how well we're doing and what we do in the future. So every dollar we can save throughout the year by being consumers, which is not easy in today's marketplace, believe me. It benefits the ability for us to do what we want to do going forward. Okay, so for 2019, again, the changes are we're actually offering two plans. I mean, we've traditionally had a plan. Now we're offering two. Mark mentioned the health savings account plan, which is a combination of an insurance plan. In insurance speak, they call it a high deductible health plan, and a savings account or a checking account, a banking account, which is called a health savings account, where that thing gets its name. We're also going to continue to offer a traditional plan for those of us who need that type of plan. And it's interesting, and one of the things that was important, I mean, you take a look at a group of employees in a meeting, and we all have different needs, we all have different wants, we all have different financial situations. So the HSA plan that was crafted, if you take a look at the open enrollment information that Dana sent out, the goal there was to try to create a plan, the HSA plan, that will keep our employee contributions, what comes out of our paycheck, relatively stable year over year, okay, because that is important to a lot of people. Now, we realize that a move to an HSA, and there are some employers who are disbanding their traditional plan altogether and going to an HSA only, but I think that's a little radical approach, so we decided it was prudent for us to offer that traditional plan with some modifications, but offer the traditional plan as an option for those who think they need to spend a little more money out of their paycheck for a difference in benefits. So those are the two plans. Now again, ask questions as we go, because we're going to move pretty quick. I want to make sure we spend enough time on the plans. One of the things I want to do first, and I kind of put them out of order, is the second handout, or the second page in your handout, is just some updated information on United Healthcare. We're not going to spend a great deal of time with this. We are familiar with United Healthcare. If you haven't, I suggest you go out and create a myuhc.com account. If I can do it, technologically incapable as I am, anybody can do it. There's a lot of information out there. Don't let that intimidate you. You can look at provider information, find a provider. As baby boomers start to retire, that includes our physicians. I've had 2 doctors and a dentist all retire in the last year. So I've had a need to go out and find a replacement provider. Benefit details, if you have a question about benefits, those are all out there online. Compare medications, we're going to talk more about that in a little bit, because part of how we can manage our own health care and health care costs is by managing our prescription drugs better than what we do. Okay? So more on that later. Again, I'm not going to go through all these slides. There's also a service on the website which we call the cost estimator, which is great. And I'm going to stop for a minute and give you an example of what I'm talking about, what Mark's talking about when we talk consumerism. So you can go out onto the United Healthcare site, pull up the cost estimator and say, I need an MRI. Okay, MRI is a great example. So I had a knee replaced several years ago. Clearly we needed to do MRIs before that got done. My doctor, who happened to be a new Aurora doctor, basically said, I can send you down the hall to the Aurora facility down the hall, and I can, and so I can send you there, and that's going to cost you $3,000 for that MRI. Okay, or I can send you to Smart Choice. Several locations, you'll see them advertised on TV and radio, and that's what we did, and that MRI cost me $570. Difference between $3,000 and $570 is important because it's deductible, and certainly under the HSA plan with the deductible, I'd rather spend the $570 than the $3,000. Smart Choice is a great facility. My doctor said that the techs are the same as what they use there. The machinery, the actual MRI machines are the same. And the Cleveland Clinic, which happens to be the Mayo Clinic of the East Coast, reads the results. So, you know, that's the kind of thing. And if you go out to the cost estimator with United Healthcare, you can put all that in. I need an MRI of the knee, and here's where I live. It knows what plan you're on. It'll tell you here are your options in your area and what it's going to cost. Okay? There is service out there, so the nurse hotline and the things such as that. So if you have questions with regard to medications, providers, bills that don't seem to have been paid correctly, we can do that. There's a pregnancy program for people, spouses and employees who are expecting. Rally is their wellness plan. If you go out to the UHC, my UHC website, you can't avoid Rally. It's out there all over the place. One of the things I think is neat about Rally, you can take a survey and it will tell you what your Rally age is, which is kind of eye-opening because I'm 63. I'll guarantee you my Rally age is not 63. It's something a little bit north of that. So the other thing I want to talk about, there's two things before we move on to the plans themselves. One is virtual visits. This is something that is relatively new, couple years perhaps, maybe even a little longer. Basically what it does is it allows me to interface with a doctor straight off my cell phone or off my computer. Now it's used for things that are not life-threatening, not urgent, colds, flus, sinus infections, pink eye, strep throat, things such as that. You can actually connect with a doctor. It's very easy to do, very quick to do. You can even set up an appointment for some time later in the day. The doctor will call you. And they can triage and actually treat you right over the phone. If you have a pharmacy that you want to send a prescription to, they can do it right over the phone. They will send it right into the pharmacy. I'll tell you that this is something that has taken a while to catch on, and the activity is not as great as everybody would like. I haven't had an opportunity to use it yet. I know Jimmy, I was talking to him before. He didn't either. But those who have used it are, to a person, very satisfied with what they've seen. Getting buzzed. So virtual visits. Now the other thing about virtual visits is that it only costs $49, for a copay it's $15 under the traditional plan. For the HSA plan it's only $49. And I'll reference it back to that when we start talking about the HSA plan. The only last thing here on this, and then we'll move on, is the fact that we do have, United Healthcare has a tiering program where they designate doctors as Tier 1 physicians based upon cost and quality. And when you go out and do a search, the Tier 1 or the premier doctors always show up first. And as you'll see when we get into the plan design, if you use a Tier 1 provider, you're going to get, or United Healthcare or the plan is going to pay more for that service than if you don't. Okay? Real quick on United Healthcare, any questions with regard to that? Yes?
How often are those tiers updated on those doctors?
The question is, how often are the Tier 1 docs updated? And I believe, Jimmy, it's annually.
Yeah, annually.
And I think that the doctors need to, it's kind of a doctor-driven whether they want to participate or not.
Correct.
And there is a credentialing process that the doctor has to go through to become a Tier 1 doctor. So there is some initiative needed on behalf of the from the doctor's end to be qualified. There's some, there certainly is some good things for the doctor in it, because again, as we start working with plans like this, we're going to push doctors or push patients to the Tier 1 doctors, for those employees that want to have the better benefits. So once a year, usually late.
It just happened actually recently. Yeah.
Just happened?
Yeah.
Okay. So with that, what I want to do is I want to move on to the actual plans. And it's there was a very top sheet that I had handed out with the salmon colored box along the left-hand side. I might call it pink. My wife says, no, it's not pink, it's salmon. Okay. So what I have here is I have taken both of our plans and put them on this illustration side by side. And I want to walk you through, we'll talk about the differences and how it works, and we'll talk as well as we go through this about this whole consumerism idea, what we can do to help reduce our cost and the cost to the city. So what I'd like to do is start on the left-hand column. This is the plan that is similar to what we have today, okay? And what I want to do is I want to spend a few minutes going through that, and then the HSA discussion will be quite a bit easier because there are less components to that. It's much simpler. So under the plan for 2019, if we look at the left-hand column or the PPO plan, you'll hear me call it a traditional plan. I use those interchangeably. So there are three components, three different sections to this plan. One is what I call big ticket items. One is what I call co-pays or office visits, that type of service, and then the other one is prescription drugs. So in that first bucket, you have your hospitals, your surgeries, your outpatient care, your MRIs, CAT scans, your expensive items that most of us don't dabble in, but some of us do. That, for those coverages or for those services, there's a $1,500 annual deductible, okay, with a $4,500 maximum per family. Okay, now, we should talk about the family, and this will hold true for both that plan and the HSA, is if I mean, you take the Green family. So it's Roger, Joan, and as I fondly call them sometimes, the two terrorists. And I'm the only one in the family that really incurs the expenses. I was an athlete. I've got some artificial joints and some things that have gone over time. So I'm really the one that uses the plan. Within the family, yes, we as a family have a $4,500 worst case scenario for deductible, but myself within the family will never do any worse than $1,500. So it does limit an individual within the family to what that single or that individual deductible is. Okay, does that make sense? Because there were some questions in the earlier meeting. So one person in the family can do no worse than the $1,500. Okay? After the deductible, then you get coinsurance. And again, these are on the big ticket items. And I'm not going to talk about out-of-network. I put out-of-network benefits on this sheet only to show the difference. Now, I will tell you that the Choice Plus network that we use with United is very, very large. And you almost have to try to find an out-of-network provider. Virtually all of our claims go in-network, so I'm not going to talk about the out-of-network benefits, okay? We can talk about that individually if we need to. So if I go see a in-network provider, after the deductible, the plan is going to pay 80% and I'm going to pay 20%, okay? If I use a Tier 1 provider, if I go out and by chance I have my doctor is a Tier 1 or I choose to engage a Tier 1 doctor, then the plan is going to pay 85% and I'm going to pay 15%. Okay, so there's a definite benefit to keep an eye on those Tier 1 doctors. So when you have the deductible plus my share, be it 20% or 15%, the worst case scenario I can do on a large expense is $4,500 for the year. Okay, so when I had my knee replaced to the tune of $50,000, the worst case scenario for me would have been $4,500. Okay, it is $9,000 for a family, but again, keep in mind that the individual within the family can do no worse than the $4,500. Okay, not all plans are like that, but the city plan is, so it's a definite advantage that way. Okay, any questions there so far? The next line item down is preventive care. And it's important to remember under either plan, preventive care is covered at 100%. okay? No deductibles, no co-pays, none of that stuff, okay? So keep in mind that that is there. And that's important, especially with the HSA plan, because as you start paying deductibles, if the only thing you have during the year is your routine annual exams, that's not going to be an expense to you under either plan. Okay? So that's the big bucket. That's the expensive bucket, if you will. The next is the co-pays. So again, if I need to see a doctor, I am going to pay $40 to see my primary care physician, and I'm going to pay $70 to see a specialist. Okay? Now here's an important difference. I mean, the benefit of seeing a Tier 1 doctor in the co-pays is rather significant. So if I'm seeing a Tier 1 doctor, and I go see my primary care doctor, instead of $40, it's going to be $25. If I'm seeing a specialist, instead of paying the $70, if I'm seeing a Tier 1 specialist, it's going to cost me $50. Okay, and that's per visit, covered at 100% thereafter. So it's important there is a definite benefit to you as the participant because it lowers your cost. And I will tell you that in the overall health of the plan and the money that is spent on our behalf for employee benefits, it benefits the plan because those doctors are more efficient, they have less redos, they're less costly. Okay, so there's a lot of benefits to those Tier 1 providers. Other things where co-pays apply, emergency room. Every time we walk into the emergency room, it's going to cost us $400. Okay, that's been in healthcare plans for many, many years. And it really is the industry's way to try to discourage us from using the emergency room unless we absolutely have to. If you are treated in the emergency room and you are then admitted, you do not pay the copay. Okay? Urgent care is a $100 copay. And again, virtual visits, which we talked about, are $15. Now, let's talk for a minute about the difference between emergency care and urgent care before we go on to prescription drugs. So, how many people, and I don't need to see a show of hands, but it's a rhetorical question, you know, how many of us actually know where the urgent care facility is closest to where we live? So if we have an issue that comes up at 6 o'clock at night or 7 o'clock at night or whenever it might be, do I have to react at that moment, or do I know that the urgent care facility right down the street is open until 9 o'clock at night or open at 7 o'clock in the morning? If we don't, we should. Because if we go to the emergency room, the cost of that care is going to be 5, 6, 7 times what it might be at urgent care. Okay, so I encourage everybody, and if you need assistance, you can talk to United Healthcare, you can talk to us at Team Red. We have a service department at our company, which Dana has information on if you need it, to help you with that. Now, a word of caution, and then we'll move on. If a facility is open 24 hours a day, even if they say urgent care, there's one provider in town that has urgent care splattered all over the front of their facility. They're open 24 hours a day. I will guarantee you they will not charge you an urgent care visit. It'll be emergency room. Urgent care, almost to a facility, is not open 24 hours. Okay, so keep that in mind as you're looking at what is in play in your particular area where you live. Does that make sense? Okay, cool.
Quick question, since we're talking about urgent care, and this might be for the United Healthcare rep, but after going to a couple different urgent care facilities, I have young children who seem to attract everything under the sun. I did find one urgent care facility that was just charging a doctor visit. Can we get a list of more urgent care facilities that will just charge insurance for a doctor visit?
Is that out online?
It's,
Urgent care?
you know, it's tough because in the state of
This is
Wisconsin.
Oh, I'm sorry, well, I should repeat the question. The question was, you know, how do we, is there a list, or how do we determine, or how do we find, you know, appropriate urgent care facilities?
So with on myuhc.com or the Health for Me app, if you search urgent care, we're only going to show the freestanding urgent cares. So like the Auroras and stuff like that that have urgent cares, if they're connected to the hospital, that's not going to show up as urgent care. It has something to do with Wisconsin state law that for us to, or for carriers to show as urgent care, they have to be standalone facilities. Those that are part of other facilities, it all ends up on how they bill it. So if you've gone multiple times, they might not always even bill it the same way, so it's really up to their discretion. So we don't even know until we actually get the bill.
If you
I would
have,
love for us to know, because if we're just going to get charged the doctor visit,
Right.
the $25 in-network
right.
copay.
What I will tell you is that if you tend to see a clinic, or your primary care doctor is at a particular clinic, at least in my case, I have a doctor, he's at a ProHealth, I live out in Waukesha, so he's a ProHealth doctor. As you come in the door, you turn left to go to urgent care, you turn right to go to your doctor visit, and they charge only the doctor visit for urgent care. So that's a question you can ask at the clinic that you go to, or where your primary care doctor is. You know, what are your urgent care capabilities, what are the hours, and what do you charge? Okay, they should be able to tell you that. That tends to be convenient, and they don't necessarily advertise it, but that would be a good place to look.
All right. So I guess it would involve us to ask when we get there.
Well, you know, that's the problem. If we try to navigate the current healthcare system without asking any questions or challenging the system, we're just not going to get anywhere. It's confusing as heck, you know. So if there's another part of this whole consumerism discussion, it's that it's time for us to start challenging some of our providers. Like I said earlier, an Aurora doc might want to send me to the MRI here for $3,000, and I'm going to go, whoa, no, wait a minute. I know Smart Choice exists. I know it's going to cost me, you know, a fifth of what the Aurora facility is. And if that doctor is worth anything, they're going to say, yep, I'm familiar with it. We can go ahead and send you there. Okay, there are some incentives that they have to try to keep the services within the family. But again, if we kind of stomp our feet a little bit and say, no, wait a minute, I know there are other alternatives. I have been successful with that. So, okay, prescription drugs. Real quick, so there's a 3-4 tier approach to prescription drugs under this traditional plan. $10 is a generic, $40 is what I would call a preferred brand, and $60 is going to be what I would pay for a prescription that is a non-formulary brand, as we kind of call it in the industry. And here's where I want to stop as well. If you're taking a drug currently that's in that third tier, I encourage you to spend a little time to take a look. You can do it out on the United Healthcare website. You can put in what drug you're taking today. It will give you other alternatives in different tiers. You can call us. We have a customer service group that can help you. There's a customer service number on the back of your ID card for United Healthcare. I encourage everybody, if you think your drug is expensive, it probably is. Okay? The reason a drug is in that third tier, a lot of the time, not always, but a lot of the time, is because there is another alternative to treat your condition in either tier 1 or tier 2. Okay, again, it's one of those things where you have to, one, identify what the alternative is, and then have a discussion with your doctor. I was prescribed as having acid reflux many, many years ago. Hopefully that's behind me. And the doctor prescribed Nexium. Well, back then everybody prescribed Nexium. Great drug for 3 months. What it did was it helped heal the damage that the acid reflux caused. But after 3 months, it was not really better than an antacid. So there's a generic omeprazole, so it's $450 for Nexium a month, $25 for omeprazole. So when I discovered this, I talked to the doctor and he said, yep, let's do omeprazole. If it works, great. If it doesn't, what's the alternative? You go back to something else. Okay, so I encourage everybody now, now would be the time to start looking at that, because we're all making our insurance decisions, to see if there is an alternative that you're not aware of that you can talk to your doctor about. Okay, so that's kind of the traditional plan that we have today. Benefits have changed a little bit in comparison to what we have right now. So effective January 1st, this is what we will have. Any questions on that plan?
Yes, I do.
Yes, ma'am.
So your in-network copays, do they apply to the deductibles at all? Will they be, counted towards your?
Good question. The question was, do the copays apply to the deductible? No, they don't. However, they do apply to the out-of-pocket maximum.
Okay.
Okay? Deductible is deductible, which is, again, just for those major items, hospitalization, surgeries, that type of thing. But, and this, how long ago did that take place? Several years now. And it was a function of healthcare reform. The Obamacare laws, one of the things that it did, it said you can't have unlimited copays, and prescription drug copays. So they do roll up. The office visit copays do roll up to that $4,500.
Okay. And I have one more question. You said your United Healthcare providers are extensive. Like, how far, what if you're on vacation in, say, Florida, and you break your leg or something?
The question is, what happens if we're traveling?
Correct.
And need to see a provider?
Right. And it's not just like an ear infection or something.
I'm going to tread on this one and see if Jimmy corrects me. If it is an emergency, okay, and let's just say emergency. I'm in Colorado, I'm skiing and break my leg.
Right.
Go to the emergency room, have it taken care of. It's going to be treated as a in-network claim. If I need an urgent care, okay, United Healthcare, their network is national in scope, and I think the largest, maybe other than Blue Cross, if you look at all the Blue Crosses across the country, one of the, if not the largest network nationally. If you go to myuhc.com and you put your zip code that you're in, it will show you what providers are in network.
Okay.
Does that, did I do that right? Yes. Okay. So again, true emergency room.
Sure.
You have no choice. They're going to treat that as inpatient. If you need to see a doctor, you got the flu or something's going on, call United Healthcare or go online and they can push you to what would be an in-network provider. Okay? Good question. Okay, let's talk about the right-hand column. Let's talk about the HSA plan, because this is really the new plan, and this is the fundamental direction that healthcare is going. And actually what's happening with these HSA plans is they're making insurance simple again. Back before HMOs, what happened is that you had a deductible. So those of us who lived in the 70s and 80s, you have a deductible. And then after the deductible, there was a share, 80%, 20%, 90-10, up to a maximum, and then everything was covered at 100%. Those type plans are where HSAs were born. They went away for a long, long time, but now they're back. The HSA plan, as we put it together, again, has two components. One is the insurance, and one is what you can do, how you can put money away in an advantageous factor or advantageous way to help pay for those expenses. HSAs tend to be less expensive, which is important to a lot of people. So, under the HSA plan, the deductible, now, I'm not gonna blur the difference between big claims, between office visits and prescription drugs. HSAs are just one big pot, okay? So I'm going to pay under an HSA plan, the plan that goes into place January 1st, I'm going to pay my first $3,000 of expenses. Okay, again, there's a $6,000 maximum per family, but if it's the Green family and Roger is the only one to use the plan, I'm going to have a $3,000 maximum within the family. Worst case scenario, if the family has other things, the worst case scenario will be $6,000. The big ticket items, like under the other plan, flow to that deductible. Office visits, which we might pay $40 for, let's say that office visit cost $110. I, under the HSA, am going to be responsible for paying the whole $110 for that office visit. Now, that is the negotiated price. Don't think that we're paying retail for that. Every doctor has an agreement with United Healthcare that dictates what those fees are going to be, okay? And if you see on your explanation of benefits, you might see a $300 charge, $200 reduction, allowable expense of $100. That's what we pay, okay? It's not the doctor's retail price, it's that negotiated price, okay? So we no longer have the co-pays. We pay the cost of that office visit, and that goes toward my $3,000 deductible. Same thing with prescription drugs. Okay, so if I'm taking a tier 3 drug and paying $60 for it, and it's a $100 or $120 drug, under the HSA plan, I am going to pay the $120, applying toward the deductible. It's very simple. Okay, it's different because we've been away from that for so long, but it is a very simple approach to healthcare. Okay, now you will see as we look in here again. Keep in mind that office visits. Keep in mind that preventive care is always covered at 100%. So even though everything is deductible, if the only thing I have is my annual exam and my blood work for the ladies, the annual exam, PAPs, mammograms, all that's going to be covered in full. They cannot charge a deductible. They cannot charge a copay.
What happens if your screening turns diagnostic then? What happens if, say, your screening would turn into a diagnostic?
Well, it's a great
Then
question.
where are you at?
That is a great question. So I'll give you an example. So my wife goes in, she knows I talk about her, so it's okay. So she went in many years ago and had her mammogram, and the doctor saw something on the x-ray. So they did some follow-up x-rays, and they actually did a biopsy. Everything turned out fine. The original mammogram was covered as preventive or diagnostic at 100%. The follow-up care was subject to deductible. Okay, so that's a great question and a very important distinction. That if they find something during that annual exam, or you're being treated for something ongoing, that's not considered any longer preventive. It's considered diagnostic or toward deductible and coinsurance. Okay? Yes?
HRA in the pink column, is that for health reimbursement account?
Yes. The question was on the exhibit, and hopefully those who see the YouTube video at some time will have the ability to grab a copy of what we handed out. Yes, the HRA is what's happening next week with the blood work. That's your health risk assessment is what that is. And there's a difference in the cost between whether you do the HRA or you don't. That's not new. That's been in place. Okay, now, again, you'll see in that right-hand column, everything says deductible and coinsurance, but there is a differential, again, between whether you see a traditional in-network doctor or a Tier 1. So if you see a Tier 1 doctor, what you will find is that that coinsurance goes from 80% to 90%, okay, whereas in the other plan, it's 85, all right? So you'll have 90% of the bill paid for after the deductible, and will be responsible for 10. 10%. Okay? Questions? So let's take a look quick at the bottom, and then what I'm going to do is we're going to go through what the Hsa Bank Account looks like and how it works and some of the rules and regs, and compare that to the flexible spending account that we're used to, that we have and would continue to use if we choose that traditional plan. So at the bottom are the monthly contributions that we as employees will pay for these plans. So you'll see on the HSA side, and I'm going to assume everybody's going to do the health risk assessment. So the $96.02 for a single per month and the $232.26 for family is actually what you are paying for the current plan. Okay? So for 2018, those are what you are paying for the current plan. It's the same contribution, but again, it applies to the HSA. On the left-hand column, you'll see that the single is $160 and the family is $386. Now I'm going to do some simple math for you, because again, the question is going to be, which of these plans should I take? Okay, so the difference in single coverage between the two plans on an annual basis is $768. If you do the math. Okay? Now, the other thing that Mark mentioned briefly is that under the HSA plan, the city is going to contribute toward your HSA account, which we'll talk more about in a minute, and they will deposit into your HSA bank account, if you're single, $750 during 2019. Okay? The actual disbursement of how that's going to flow into your HSA account and on what time frame is still under discussion, and we should have some direction for that soon. But over 2019, singles are going to have $750 deposited into their HSA bank account by the city. So if I take the savings and premiums, let's say I take all the savings between the two plans, I put those savings into my bank account, I'm paying a little bit over $1,500 a year, okay, or half that $3,000 deductible. I may never spend it. We'll talk about what happens in a minute. On the family side, the difference in premium, if you annualize it, is at $1,845, okay? The city is, for a family plan, is going to contribute $1,500 into the HSA bank account. So you combine the two, that's $3,345. Yes, sir.
That is a one-time contribution.
You know, that's a great question. Mark, you wanna field that one?
Yeah, I will. For 2019, it will be a one-time contribution. We don't know if it will continue. How we're funding it for this year is, this past year, we actually had some very good claims results with our stop-loss insurance. Our stop-loss insurance is the secondary insurance we buy to protect against very large claims hitting our plan. Those are individual claims where one person has more than $60,000 in claims in a given year. We usually have anywhere from 4 to 6 to 8 to 12 of those in any given year. So we buy insurance to protect against those very large claims. Our most recent insurance provider had a sort of a rebate program. If we had a low year with those very large claims, they funded some money back. So we took that money and said, hey, let's use that to help people transition into setting up the health savings accounts, being able to have some money going forward, because if you haven't been saving it, you might not have it there. You might want to join the plan, but think, what if I get a bill? What am I going to do up front? So we did recommend to the Common Council, and they authorized us to move forward with that. We haven't yet decided exactly how to spread that out over the year. We're hoping to have that resolved within the next week or two. We're leaning toward having sort of $500, maybe a third of it, within the first 4 to 6 weeks. 3 months later, another third, and another third 3 months after that. So you'd have all of it by just past the middle of the year or so. But again, that's just sort of the direction I'm thinking. that will yet to be decided. We know we're doing that for this year. Don't know for sure if we will have any or reduced amount for future years. So it's something we'll consider as we get into next year's. We're really hoping though that this added incentive helps encourage people to take advantage of taking a good, careful look at the high deductible plan. It's new, it's different, and so it's really easy to just say, I'm not comfortable, I'm not going there. So we're putting this there basically to make people say, okay, someone's offering me $1,500 free, I ought to take a look at this. And that's why we're doing it. And because of those good claims, I could turn around and tell the Common Council, let's feed this back to the the employees that sort of generated that rebate. So does that answer that question?
Yes, yes, I can.
Hang on, we had one question I think related to what I was just saying.
Well, if you switch to the high deductible plan next year and it doesn't work as well for the individual as the other plan, can you switch back? Or is it a one-way door?
It is an annual,
It's an annual
selection during the open enrollment
Okay.
period.
Correct.
And that'll be a good segue back to Roger.
Yes.
Going back to the monthly contributions,
Yes.
if you're a part-time employee, you just double that?
I'm going to have to defer that to Dana.
No, if you look at the open enrollment letter where it shows you what the city cost is of the plan, I can calculate it for you. If you're a half-time employee, you would get half that benefit.
Okay. Thank you. So those are the two plans themselves. If we don't have any further questions there, and again, I'll be available and Jimmy will be available afterwards. I'm going to be here next week for specifics. If not, I want to go ahead and talk about flexible spending, which we have today, and HRA bank accounts, which is new because
HSA.
of, pardon?
HSA.
What did I say?
HRA.
Thank you. Thank you. HSA. We use too many acronyms in our business. But before we move on, I want to mention that Dana sent out with the open enrollment packet a listing of what we call preventive care drugs, if you will. And those drugs, if you take a look at that list, the drugs on that list are drugs that you don't pay a deductible for. It is specific to the high deductible health plan. You pay coinsurance. You immediately start into that 90-10 corridor. And I made the mistake of using the example of Lipitor in the first meeting, come to find out that Lipitor is on the list. So there are some drugs there that you might find that you wouldn't think are there that are. Again, I use several drugs for different reasons, and several of them are on that list. So again, depending upon the drug you take, that is important. Now let's talk drugs a minute before we talk HSA, before we talk the bank accounts. Because I did not mention, I talked about it when we talked about the traditional plan, but prescription drugs are critical for us to take a look at and be aware of if we're going to move to the health savings account. The reason being is that if you go to a doctor visit under the HSA plan, you're going to go, they're going to take your card, they're going to see you, they're not going to charge you anything at the doctor's office. It's going to go from the doctor's office to United Healthcare, they're going to do whatever they do, and the doctor will bill you after the fact. Okay, unlike the co-pays, which we pay up front right away. Prescription drugs at the pharmacy, you have to pay for them at the pharmacy. There's no way to do that same mechanism where it goes to the provider and they bill you later. So the pharmacist knows at the time they fill the prescription what the cost of that drug is. And that's what we will pay when we go to the pharmacy. Early on in the game, it's critical that we pay attention to what our drugs cost. Because I will tell you, I will have people, after we make this change, who are used to paying the $60 Tier 3 copay, that will come to me and say, I didn't realize that my drug was $600 a month. okay? And if it's $600 a month, that's what our cost is going to be for that drug. That's one of the reasons why the contribution by the city is going to be important, so that it's a cash flow issue. So again, it's real important, especially if you take several drugs or take some drugs or take some that are in that high tier category, that you do a little research, talk to UHC, go to myuhc.com, talk to Team Red at my organization. We can help you identify what that impact is going to be. And again, if you're taking a real expensive drug, now's the time to say, hey, are there alternatives? Okay, very, very important. Okay, let's talk about putting money away to cover healthcare expenses, and we'll be done here shortly. So currently we have a flexible spending account, which we use with our current plan. It allows me to put pre-tax dollars into an account, so when I put money in there, President Trump doesn't see a piece, Scott Walker doesn't see a piece. It all comes out before taxes. And it's traditionally used with that left-hand column plan. There are some exceptions, which I'll talk about in a minute, but flexible spending is what you would traditionally use with that traditional PPO type plan. You can put $2,500 away in that account, and under the flexible spending account, the way it's set up is if I put $2,000 or determine I'm going to put $2,000 into the account for the year, I have access to that $2,000 right away. Even though it's going to come out of my paycheck throughout the year, if I need that money early on in the plan year, it is available to me. Now, the thing about flexible spending is, you know, once you make an election, unless you have a major family event, you get married, you get divorced, you have a child, that type of thing, you cannot change that election. Okay? And that's not the city rules, that's not the insurance company's rules or the administrator's rules, that comes from Washington. Okay? Now, you have 45 days or 75 days after the beginning of the year until March 15th to spend that money or use up all that money under a flexible spending account. If you have any money left over, at that point it's forfeited. Okay? The old use it or lose it clause, as we used to call it for years. And again, if you choose the traditional plan, that's the plan, that's the savings vehicle, or the tax vehicle that you would use for that plan. Hasn't changed, and the rules of that plan haven't changed. Okay, so let's spend a couple minutes on the HSA, because it is different. And I included in your packet an employee guide. We have, one of the things that many employers do is they will arrange with a financial institution to make it easier for us to set up these HSA bank accounts, because it really looks much like a checking account. You know, you get statements, you have a debit card, and the whole 10 yards. So it's really, it looks and tastes and smells like a checking account. So we are partnering with Associated Bank, who has a plan. They have the bank accounts. They pay interest on the money. If you have a $1,000 balance in the HSA plan, you can invest that money in mutual funds. Okay, it's one of the very lowest thresholds that I've seen whereby you have the ability to do that. So if you have $1,000 in that account, you can invest it. You can do several things with that money. That information will come out more after we've had open enrollment and we know who's interested in the HSA plan. Then we'll get Associated together with us to talk about that. You don't have to use Associated. Most banks these days allow and provide for HSA accounts. So if you have a bank, you might want to, in the next few weeks, see if they have an account. The Associated Bank program for at least the first 2 years will be no fees, so there will be no fees charged. I think we talked about after 2 years, I think it's $2 a month in service fees. So the banking, we have a partner that we're going to use, but you can use your bank if you choose. You could take the money out, payroll deduction. You can say, Dana, take $100 a month or $200 a month out, same way as you do with the Flex. Or you can actually put money in from another account straight into the HSA if you choose. And that money is tax advantaged as well. You just do it when you file your 1040s at the end of the year. So what I want to do is spend a couple minutes with this, and again, I'm not going to go through in detail. So if you turn to page 3, the question will come up, who can set up an HSA? So you have to have, from a coverage standpoint, the high deductible health plan, which is the right-hand column of the HSA plan. Okay? You cannot use an HSA bank account with a traditional plan that has co-pays and the such. They don't allow that to happen. So if you have the high deductible health plan, you can open an HSA account. But we have to be careful. I don't see it much today, but if for some reason you have coverage also through a spouse, okay, and again, I don't see it because it's become too costly, but if you're covered under the spouse's plan and that plan is not considered a high deductible health plan, you cannot open a bank account, okay? I mention it, I don't expect it applies to anybody, but that's out there. Medicare as well. If I'm over age 65 and I've got Medicare, they don't allow me to establish an HSA bank account. Yes?
I actually have a secondary insurance through my husband, and he has an HSA.
You are perfect.
Okay, so it doesn't that.
You are exactly
Okay.
right. Yeah. Now, if you had secondary coverage and his coverage was more primary with co-pays,
Okay.
you couldn't do it. But because this is an HSA plan, absolutely.
Okay.
Okay. When can I set up an HSA? You have to be covered under a high deductible health plan, so it'll be January 1st. Okay, I encourage everybody, if you take the HSA plan, set the HSA bank account up January 1st. Okay, reason being is if I have expenses in January and I don't sign up or I don't establish the bank account till February, I cannot submit those claims I incurred in January to the account. The account has to be in place. Okay, so we'll work with everybody who takes the HSA accounts to make sure all that's in place, you know, when we get to January 1st. We talked about where can I set up an HSA. Again, we're going to have Associated Bank who will have the ability to come on site and help us with that, or we could use our own bank. What is a qualified high deductible health plan? There's lots of rules and regulations here. Suffice it to say, the plan that we have crafted for the HSA plan does meet all of these requirements, so we're not going to go through those. You can look at them, make sure you're sure. Page 4, can I be covered under another health plan? We kind of talked about that one. Dental, vision, if you participate in anything other than medical, it does not affect your ability to participate in a high deductible or the HSA account. Now, the second half of page 4, so I said you cannot use the HSA account if you take the traditional plan. You would use flexible spending. There is an application that you can, if you're in an HSA plan, you can have a flexible spending account, but you can only use it for dental and vision. Okay? So if I'm putting money into an HSA, I can't establish a flexible spending account to cover medical. That's what the HSA is for. But if, let's say I've got a child in braces and it's going to cost me $200 a month, I could set up a flexible spending account if I want to put additional money away for dental and vision. It's called a limited flexible spending account. And you'll see that on the election form when we get there.
Roger,
Okay.
could you, since you've talked about that, could you point out the fact that not only can you not have them at the same time, but we have to end at December 31st.
Yes,
if you have a
good
current
point. So if I'm in the flexible spending account now, let's say I have a traditional plan, and I have the flexible spending account, and I'm going to go to the HSA come January 1st. I need to make sure I exhaust the money in my flexible spending account before the end of the year. Okay? We talked earlier about the fact that there's kind of a 2.5-month rollout. However, you can't have the flexible spending and the HSA in play at the same time. Okay? So take a look at your balances if you have some flex. Most people, and I always did this, you know, I always was kicking myself because I always ran out of flex money in October or November and still had some expenses. But make sure you take a look at those balances and clean them up as best you can by the end of the year if you're going to go to the HSA plan.
You're talking
Okay? So on page 5, how is an HSA funded?
Roger, if I could, there was a question in the back that's a good question. She said, Sandy asked that we're talking only this year. It actually applies for any year if you make a move from the PPO to the high deductible health plan where you want to have that HSA. You know, since you can switch back and forth between plans at open enrollment years, you could be in the high deductible plan, move back to the PPO, establish an FSA again that you're using for that year. But then if you decide the next year, you know what, we're going to get back in that high deductible plan, any money in that FSA for that year, you have to finish by December 31st.
Yes.
So if you're in the HSA, but you currently have a flex plan, you're saying this year you have to use that flex plan by December 31st.
Right.
Correct.
If next year you do the HSA and you do a flex plan for dental and vision, at the end of 2019, do you still have 2.5 months to do both of those, or does the flex end at December?
Great question, and if you have the limited flex, you do have the extra 2.5 months. Because you're using it for dental and vision only. Okay? And I'll get to the question on going from the HSA to the other plan in a moment. Okay? Because it's important. Okay, so how is an HSA funded? I'm on page 5. So you have a combination here. Your employer can contribute, you can contribute. If you got a parent that wants to contribute, I mean, there really is no rules on who can contribute into your HSA bank account. The bank does not care. But if you go down to the bottom, it says general contribution limit. So in 2019, the most I can put in as a single is $3,500. For a family, I could put $7,000 in there, okay? But that is a total contribution combining what I put in there and what the city puts in there. So it's not $3,500 of my money plus $750 from the city. It's a combination. That total cannot exceed $3,500. In your guys' case, it's that family limit. Okay, so even though you both have high deductible health plans, between the two of you, you could not put in more than the $7,000. Okay? Questions on that, because that's important. Okay, we go to page 6. Quick, if you're over age 55, they allow you to put an extra $1,000 into the account. If your spouse is over 65 and she's, over 55, and he or she is also covered under the plan, they can put an additional $1,000 in there as well. Okay, and again, that has not gone away. I expect that to continue every year. If you're over age 55, you have the ability to do that. Put extra money away. Says what happens if I put too much money into my HSA? Don't. It's just a hassle. Okay. Any money that you have, you're going to have to get out of there before the end of the year. You're going to have to pay taxes on it because everything when you put money in is all pre-tax. So just be real careful, and again, it'll be tricky, but make sure you're combining not only your money that you're putting in there, but the city's as well. Okay, now, using your HSA funds, page 7, and we'll get through this here momentarily, and we'll be all done. So, I can put all of this money into my HSA account. And remember when we were talking about the flexible spending, I said if you don't use it all after the end of the run-out period, you lose that money. Under an HSA account, that money is yours. It stays in the account. It continues to accrue interest. If you have over $1,000, you can continue to invest it. And if, let's say I put $7,000 as a family in there for 2019, I spend $2,000 of it, I have $5,000 left, I can put another $7,000 in that account in 2020. There's no maximum, it's just the annual limit that I have to be careful of, and that money can accrue and accumulate and earn interest for many, many years. When they first established HSAs, the idea was to create a medical care IRA for people to put money away into a tax-advantaged vehicle to use down the road for Medicare and those type of things down the road. It was really why it was established initially. Okay? Who determines if an expense is qualified for reimbursement? So I put all this money into the account. As long as I'm using it for medical care expenses, I'm not going to pay any taxes on it. It's going to come out. I'm going to use it. All the interest and earnings that I've made are not taxable as long as I'm using it for medical care expenses. The same expenses that are eligible for flexible spending, they work under the same rules. Okay? So as long as you're using it for medical, you're fine. Now, for those of us who have been in flex, you'll know that at times when we submit a flex claim, the administrator asks us for a copy of the bill. They need to justify. That's their job. Legally, they have to do that. Under the HSA, we are responsible for policing that. So money goes into my account, I spend money, you know, the IRS and the government assumes I'm spending it for medical care. If you're audited, they will find out. Okay? So if you're ever audited and you say for 2019 I put $3,000 into my HSA account and I spent $1,500 or took $1,500 out, the auditor is going to say, I would like to see the bills for the $1,500. Okay? So keep your receipts, keep that stuff, put it in a manila envelope, seal it up at the end of the year, put 2019 on it, throw it in your tax files. Okay? You can take money out of a HSA account for non-medical expenses. However, it's just like taking money out of an IRA. You pay an excise tax of 20% plus ordinary income. So you can get to the money, but the impact is the same as if you pulled money early out of an IRA.
So Roger, could you clarify one thing for me? So if I go to the high deductible health plan, establish an HSA, I'm in there 1 or 2 years, I put the maximum amount in, so I got a lot of money there, but then I decide to either switch to the PPO or I switch jobs and go to another employer and they have a PPO, can I still use the money in my HSA for these costs that are in a non-high deductible health plan?
Absolutely. He just moved us to page 9. He's jumping ahead. See, I've got him trained, so he knows how to get us moving forward. Yes, so the question is, and this kind of goes back to moving between plans. So if I have an HSA account and I put money in, and then for some reason, let's say I leave Franklin, or I choose the other plan, that money is still mine. It's still in my account as long as I'm using it for health care. So co-pays work, deductibles work, dental, eyeglasses, all of that. I'm fine. I just can't put any additional money into the account. Okay, so as long as I use that money for health care, whether I have a high deductible plan or not is really immaterial. I can use it for health care expenses. It's just if I'm not covered under a high deductible health plan, I can't add to the account at that point in time. Okay? One other quirk, there is some lists at the very end of this. There's a list of items that are considered qualified expenses. And on the very last page, there are a few things that are examples of things that are not. And again, this is the same as what we have with flexible spending. So the rules are, and what we can reimburse ourselves is pretty much the same. Now, before we finish, I do want to differentiate one other item, which is kind of weird that it exists, but it's important for us to know. And that's how dependent children are handled under the plan. So under the flexible spending plan, you know, healthcare allows us to keep our kids on the plan up to age 26. Doesn't matter if they're dependents, doesn't matter if they live with me, doesn't matter if he's a brain surgeon in New York making 5 times what I make. If I want to have him under my plan, I can include him in my health insurance. Flexible spending, I can use for his expenses, because he's covered under the plan. Under a health savings account, it's a little bit different, and that child has to be dependent on me. I have to be able to deduct him on my income taxes, okay? So that's a fundamental difference, and that, you know, if you have a 23-year-old that's at home, and you can still deduct them on your taxes, yes, you can use your HSA money if for some reason that child is independent. Even though they may be covered under the health insurance plan to age 26, you cannot use your HSA money toward their expenses. Okay? Questions? Again, we'll be around, Jimmy and I will be around for a few minutes after the meeting. I'm here next week. I'm sure what's going to happen is you're going to have 100 questions over time when you start taking a look at this. So pop your head in next week if you need some specific or have some specific questions.
Looks like there was one back there.
Oh,
Could my daughter's 18.
yes.
Could she start her own HSA
If
my insurance?
if she is covered under a high, so I mean, is she covered under your plan?
Yes.
No, she cannot. I mean, if she has her own plan, has her own coverage, and has a high deductible health plan, then yes, she can. But as a part of your plan, she can't.
We can't use our money to pay for her.
Well, up to age 19, if she's no longer a dependent, you know, then yeah, you can't. And again, that's not a city rule. That's not a. I mean, that's a Washington rule. Why they did that, we don't know. The inconsistency is always annoying.
And just a quick question, even if it's a pre-existing condition?
Mm-hmm.
The two laws were made at different times with different intent,
Yep.
and they just don't align. So when the IRS got the laws, they said, this rule applies here and this rule applies here. So, and there's nothing locally we can do about that. So we urge you to take a good, careful look at this, because the high deductible plan is different for people. Read through the handout. It really sort of will help solidify some of the things he talked about and maybe fill in a few blanks that maybe we didn't cover. But when you look at the fact, if you've got a family plan now, that we've structured it such that the premiums, or your employee share of the premiums, are about $1,800 a year different, lower than if you move to the new PPO plan, plus that $1,500. There's definitely an incentive for you to move there. So why are we doing that? Because we want people to really get more engaged in selecting their health care costs, and the high deductible health plan is a way that the private industry is really moving towards being able to do that. So we're bringing our plan up to that sort of level and creating that same incentive that is more prominent nationwide in the health insurance industry. Looked like you had a question.
Yeah, I guess I'm just trying to make sure it's as simplistic as it seems. For the high deductible plan, basically, for the first $3,000 for me, I basically don't have insurance, correct? I mean, you don't have insurance.
The reason that's not a fair answer is because United Healthcare has gone out to all their network and negotiate a better price. So if you didn't have insurance and you walk into your doctor
That
for a
price would be
visit,
much higher.
you're probably paying $250, $300.
All right.
Through them, then maybe it's down to 100, 120, or 80, whatever it is. So you still have insurance in that high deductible plan that's getting you a lot more health care than you would be getting, you know, for that same three. But yes, you're paying the first dollar amounts out of all of those buckets he talked about. You know, everything but the
But our
preventive,
monthly
that's 100%.
premium is staying the same. It's not getting any lower for that.
No, but to stay in that traditional plan, the premium is going up considerably. For the family plan, it's going up a little over $150 a month. So that's where that $1,800 in savings comes in if you elect to move into the high deductible health plan and set up the HSA. So we hope people take a good, careful look at that, look at their specific circumstances, and see if it will work for them. If not, we will have and maintain the traditional PPO. You know, we have no plans on eliminating that plan anytime soon. We're hopeful that we'll have a you know, a good quarter of the people at least, if not more, realize that this is a good mechanism for them. And over time, most of the employers that I talk with, I participate in a business healthcare group that has Kohl's and Badger Meter and Harley Davidson and all the big companies in Milwaukee. It's a massive health insurance group that all participate in. They've seen when they've created the high deductible plans that over time it builds up to have a majority of their employees realizing it works for them. So we wanted to make sure people had a chance to look at it. So he mentioned he'll be here when we're doing the HRAs, the blood draws later in the week. We have another one of these tomorrow. You can also email any questions to Dana, and then Dana will either be able to answer it or coordinate with Roger to get you an answer. Because we do want to make sure people have time. We started our open enrollment early so that people had more time to consider it, you know, be able to go out and look and talk to the pharmacist and find out what their drug really costs them, you know, so they understand what will roll into that. Any more questions?
Thank you.
Thank you very much for your time. Appreciate you coming by.